Hey, everybody. Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director at the Institute for Healthcare Consumerism, along with CEO and founder Doug Field. The next guest here, very interesting guest here coming up and, doing some very interesting things in the transparency space, plus some more things as well with a new product they got. We want to welcome Todd Covert, National Director of Strategy with Mutual of Omaha. Todd, welcome to the program.
Well, thanks for having us. I appreciate it.
Now, you guys are doing some pretty interesting things with this new product. Tell us, Todd, tell us a little bit more about Mutual of Omaha and then a little bit more about what you're doing with this new product.
Sure. As you well may not know, Mutual has really been in the employee benefits arena for about the last 60 years. And what we wanted to do a few years back, about 3 years ago, we really wanted to start bringing some more shared value for both our partners and for our customers. We really wanted to focus on the cost of healthcare. We exited the healthcare space about 3 years prior to that, so about 6 years ago. So we have some pretty good knowledge about how networks are built and how claims are really on an unsustainable path, and we wanted to use some of that knowledge and some of our relationships with consultants and brokers around the country to really get at the actual costs of healthcare. So we are on our road, so to speak.
So this is MPOWER360 is actually the solution's brand name, correct?
That's correct.
And
it's completely owned by Mutual of Omaha.
Okay.
And we have over a couple hundred people within the Mutual of Omaha Group Benefit Division working on the project.
That's excellent. I mean, you talk a lot about it being a strategy, versus sometimes we think of these as tools. So talk about that a little bit.
Sure, that's a great point. We've really got we believe that there's been 146% variance in workers' wages and healthcare contributions over the last 15 years. So we believe that we can't just keep putting more risk and more exposure onto the employee or change the financing of who's paying for care or trying to really suppress the demand of healthcare. We've got to use some of our bandwidth, so to speak, to really focus on the root cause of the problem, which is the cost of healthcare. So it really is a strategy. It's not just about one piece, and we'll talk about kind of really what we believe is the episode of care, which is medical cost and quality, prescription drug waste that employers are losing in the PBM world, misdiagnosis and unwarranted use. Really, it's our biggest problem yet. We're not focusing on that enough. 12 million Americans every year are misdiagnosed. We'll kind of talk to you about some of those solutions as well, and then directly contracting with providers when we can.
What do you see, what are the key, I mean, you kind of talked about some of the difference, but when you look at the competitive landscape, I mean, there's a lot of room for players in this space, but when you look at, what did you look at from a strategy standpoint and to make your solution different from the other players in this space?
Sure. That's a good point. Really what we've tried to do is focus on engagement and bringing in the entire episode of care. There's a lot of pieces out there in the marketplace, whether it be online transparency tools, carrier tools, prescription drug tools. There's actually a couple services now that offer second opinion services, and there's some people that do direct contracting. But what we've done is we've brought all of that under one technology platform, one strategy, as well as one intake, because we have a number of clinical nurses in our program that help navigate the employee through that episode of care. So really what it looks like is, John or Betty calls in or works online through our technology for a knee replacement or an MRI. So we're going to give that employee cost and quality, and we've got to be diverse in how we communicate with people. We've got to give them both technology to look that up, but we've also got to give them the human element to help them. So John or Betty gets that MRI. he's probably on some type of prescription drug where we're going to attack the spread pricing inside of the PBM world.
Okay.
And then after that, what we're going to do is make sure John or Betty is diagnosed correctly. Mm-hmm. We all know of the misdiagnosis, and unfortunately, this fee-for-service industry we live in, the more they cut, the more they prescribe, the more they get paid.
Yeah.
So we're gonna work with some of the top 40 hospitals around the United States, like Cleveland Clinic and Hopkins, to make sure that they're diagnosed correctly, that they really do need to get cut or prescribed a medicine, get them a updated treatment plan or a proper prognosis and a diagnosis, and then maybe even directly contract with centers of excellence around the country to complete that episode of care.
So Todd, this is this is not only the transparency component, but this has an advocacy component for the employees, right? That's what you're really talking about now.
Yeah.
Excellent.
Yeah, yes, we do. And what we've found is, believe it or not, a lot of cost and quality, we all know how confusing healthcare is. I think there's, who knows how many MRIs there are for a knee with contrast, without contrast, with dye, without dye. You get a stress test order. There's, I think, 7 or 8 different stress test types. Right. The common employee is really going to struggle just going to an online solution to look up cost and quality. But there's also a big hole in online cost and quality. And really what that is, and one of the things that we're really hanging our hat on, is financial incentives. We all know that we can't really use the stick approach yet because not too many carriers can administer, fluctuating plan design. You go here, we pay this. You go here, we pay Y. Right. So what we've really tried to do is create incentives, and because we own a bank, and because we have technology to get your electronic EOBs and all of your HSA under one platform, we're able to create these financial incentives. So when people do go and get care, we can reward them. And the most important thing I think people need to realize is 80% of our claim activity comes from 20% of our population on any given year. So what does that mean? That really means that these people, a small portion of these people, are driving a huge amount of our claims, and those people have already been through their deductible. It doesn't matter if you have a high deductible, low deductible. So how do we get them to care? Instead of just getting in a small piece of the pie, through financial incentives, we're going to motivate and engage everybody. Yeah. So one big piece that I think employers really need to consider.
I think that's a great point. We talk about that all the time, is that, the HSA and the high deductible is one thing, but how do you keep people engaged as healthcare consumers once they reach that 100% coverage or at 80%, whatever that is, whatever it is, but a lot of plans have the 100% after a high deductible. I got another question. What's your business model, Todd? What's your pricing and business model?
Our business model is we are per employee per month business model. Okay. It really depends on the size of the group. I think our costs are less than 1% of claims cost. We do have some performance guarantees because we actually can verify by EOB where somebody went. We can really quantify ROI, and I think that's one other big place where we're different, is being able to quantify where somebody was going to go, especially with financial incentives, where they were going to go and where they ended up going, to see if transparency is really making a dent. Because you just have online transparency, it's really a guess of calculating ROI.
Particularly at this early stage, like to your point, people need help. They want to, they need accessibility via online, but they're going to they reach a point where they want to talk to somebody and get a little bit of hand-holding, get some help.
Right. And it's really, again, it's taking that employee. It's not just about medical cost and quality. Yeah. It's about prescription drugs. It's about misdiagnosis and unwarranted use. And it's about directly contracting with those providers when they do need a knee replacement or a hip replacement. So.
And what's the typical size of company target, or is there one that you guys are focused on?
I think self-funded employers are obviously,
Okay.
Is the key.
Right.
We'll go down to a couple hundred lives. And then we go up to, I think our largest group right now is about 12,000 employees.
Okay. Todd, we got about a couple minutes left on the program here, and want to give you a chance kind of give us a feel for where you see the market, in the next, 10 to 15 years, as it relates to transparency and the other moving pieces that you're talking about.
Right. I think, employers, we need to come together and really fight and focus on the actual cost of care, use some of our bandwidth, some of our resources to put pressure on providers to give us better cost and better quality. That if we don't come together and focus on that, then we're completely on this unsustainable path. It's mathematically broken. I think Warren Buffett said it perfectly a couple weeks ago. He said, we don't have an access issue, we have a cost issue, and I think technology will continue to grow. I think we're living in this connected economy now, or connected, really, industry where, we've exited the blue collar, the industrial revolution. We're going into this connected economy. I think wearables, technology will continue to advance. The Moore's law of every 7 years. I think, technology will continue to innovate inside of healthcare to make things make things better for employees. And I think eventually, if we stay in this self-funded arena inside of the corporate employer world, I think there's going to be a lot more direct contracting. I think we see that with Lowe's, and I think Walmart is doing a lot of direct contracting, and that will eventually go down to the middle and large market. So those are really the three things that I see happening over the next 5 to 10 years.
Yeah. Now, Todd, again, everybody, we're talking about the MPOWER360 product from Mutual of Omaha. Todd, let everybody know how they can contact you about the product or find more information on the product.
Sure. You can contact me. I'm on LinkedIn. Just Todd Covert, C-O-V as in Victor, E-R-T. I give you my cell phone number. It's 248-756-0569. Again, 248-756-0569. Or you can contact me via email at todd.covert@mutualofomaha.com.
Hey, Todd, we really appreciate you coming on the program with us this morning, and have a great weekend. To the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.